Hey everyone, it's Dr. Sarah here. Welcome to the She Found Motherhood podcast. Today, I have the absolute pleasure of talking with Teela Tomassetti. Teela is a doctoral student, focusing her studies on birth trauma. Teela and I have a really open and honest conversation today about birth trauma, and she shares her own personal experience. Now, before we get into the podcast, I want to offer a trigger warning that Teela shares openly and honestly about her experience with birth trauma. We have this conversation because Teela and I, and many others, feel that birth trauma is a topic that is not talked about enough, and we need to bring it into the forefront and encourage women and birthers everywhere to share about their experiences so they can begin their own healing journey. We'll get into the podcast with Teela right after this quick message.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Okay, good morning, Teela. Welcome to the She Found Motherhood podcast.
Thank you for inviting me.
Oh, I'm super excited to have you here and excited to talk about the subject of birth trauma because I think it's something that we need to talk about more and need to normalize and help people to understand.
Definitely. Yeah, I'm really excited to be here to talk about this because it's something that I think we aren't discussing enough, yet despite the impact.
Mhm.
So I'm happy to assist.
Awesome. So I thought we would get started and you could just introduce yourself and tell us a little bit about who you are, the work that you're doing. I know you're doing your doctorate. I clarified that just before we hit record. And if you want to share your story and how this work and the information you've shared on Instagram came about.
Yeah, absolutely. So my name is Teela Tomassetti, and I was just sharing with you that I originally come from Winnipeg, just moved to Sherwood Park, Alberta, just over or almost 2 years ago now. And we actually moved here to start a family. So I've been a therapist now for 15, 16 years and in a variety of different areas, but specializing in trauma work. So anywhere from childhood sexual abuse to domestic violence to sexual assault and all kinds of other traumas like homicides and things like that. Where I got involved with birth trauma is that after I completed my master's in counseling psychology program, I knew I wanted to do my doctorate in trauma work. And then my best friend at the time suffered from something called birth trauma. And I will be completely honest, I tell people this all the time. I had never heard of birth trauma. I was like, what's birth trauma? And she had hemorrhaged and had a really terrible experience afterwards in terms of recovery and in terms of bonding with her baby. And as a result, ended up with depression and anxiety, and still to this day, 4 years later, is dealing with the impact of birth trauma. And so, in listening to her story and hearing how little it is discussed in the social services world, I made it kind of my dedication to do my doctorate for her. And so this was a couple of years ago that I said, you know what, I'm going to do this. I want to dedicate it to you and see what kind of work I can get done in this field. And then little did I know that I would end up with my own birth trauma. So did you want me, Sarah, to speak at all to
If you're happy to share, we're happy to
Yeah, so
hear your
it's still
story.
for me. Livy, my baby, will be 6 months this Sunday. So it was just 6 months ago that this all took place. But it's quite a lengthy story, but I'm going to try and narrow it down because there's two different elements to my birth trauma that happened here that I discuss with people. So the first is midwifery violence that took place in my home. So originally my birth was going to be a water birth and it started out that way. But it took quite a turn at home. There was a lot of violence that took place in my home because of the midwife and a lot of abuse. And I won't go into the details around that because I actually reported her to the association and they're in the midst of investigating her and I'm in the midst of dealing with that. So just to stay professional and to keep this kind of behind closed doors for now, I won't speak to that end of things. But what happened was that after begging to go to the hospital for hours because I knew that something was wrong because of the prolonged labor and pushing for a long time at home, I got to the hospital and doctors actually intervened. And Dr. Wong, I'm going to just shout him out because he's incredible here at the Royal Alex in Alberta. He intervened in the situation, explained that I needed to have an episiotomy and forceps done, that I had prolonged labor, a fever, and an infection. And as a result, he was concerned for me. So he wasn't worried about my baby. He was worried about the state that I was in. So I managed to get her out on that second push with forceps because he said, if you can't, I need to move to an emergency C section for you. So we got her out, and I didn't realize moments later that I was hemorrhaging. And so I'm sure, Sarah, there's two different kinds of hemorrhages that can take place. There's a primary hemorrhage, which is where loss of blood is 500 ml and under. And that's actually quite common with women. They do lose blood during giving birth. But I had an excessive hemorrhage where I lost over half the blood that exists in my body and required blood transfusions as a result. And I was in the hospital for almost a week. My veins were collapsing due to them having IVs hooked up and that. So it was a long journey after that as well, because 6 weeks later, I hemorrhaged again at home due to a retained placenta and was in the hospital for a D&C, a surgery to remove that retained placenta. And as a result of that, so there's many layers to birth trauma. That's something that people don't also consider as the long-term impact. But as a result of that D&C, I actually contracted C. diff, which I'm sure you're very, yeah. It was such a severe case of C. diff that I've been on 3 rounds of medication for it, the vancomycin, and now been through 2 fecal transplants as a result. So I'm actually part of a clinical trial. I know, well, Sheila, I'm just like, I already over here for you. Yeah. So, and I'm like, people give me heck of it because I sit here and I smile while I'm telling the story. And that's really significant to birth trauma. We detach from it when we tell our stories. We have to in order to get through it. And I will share with you, Sarah, that the biggest and most significant part of my birth trauma was not almost dying, because that is what took place for me. I was a near miss, but it was the midwifery violence that happened to me in my own home. So it's interesting because when they share that story, they're like, oh my God, you almost died. I'm so terrifying. This is where your birth trauma comes from. And it's actually, no, it's how I was treated. That's the lasting impact that really has been had on me. So that in a nutshell is my own birth trauma. Any questions?
Yeah, right? Oh my gosh. First off, I want to say thank you for sharing. And I just want to say, I know no fault of my own, but I want to apologize for what you experienced. As a maternity and obstetrical care provider, it horrifies me to hear that your needs were not met and that your voice was not listened to. And birth is so scary. It's so beautiful, but it can be so scary. And when you don't have control over your own body, it can be so overwhelming. And to hear that you knew, you had the intuition that something needed to happen and that it wasn't, if you weren't being listened to, I can understand how that could be the most significant. And that it was in your own home.
Yeah, that is definitely the hard part because
Yeah.
the symptoms come as a result of birth trauma is flashbacks and nightmares
Yeah.
and
Yeah.
intrusive thoughts and avoidance and isolation, all trauma symptoms that we think of. And yeah, I think about it every time I step into my living room
Yeah.
where it all took place. Like it was in my own home where you're supposed to feel safe and
Yeah.
secure and heard. I yeah, but that's
Yeah.
not the case.
Thank you for sharing your story because I think in listening to this, some people might realize that they may have had violence enacted against them and not simply by midwifery, by a maternity provider, by a nurse, by anybody that's involved in your care. So if you feel that you weren't heard or listened to, or you felt that things were unsafe, it's important to share that, not only for the safety of other people coming behind you, but also for your healing journey, I think. Now, maybe we can move into talking about like birth trauma, like what is birth trauma and how do we define it? How is it identified? And how can somebody know if they themselves have maybe experienced it, but they are, like you said, we all do, they're detaching from it and trying to just move on.
Yeah. And we're encouraged to move on too, because at the root of trauma is loss. And so we all know what loss is like in our society in terms of like, we're given a year and then hurry up and move along. Well, with trauma, it's even quicker than that. We expect people to bounce back really fast, especially in motherhood. which I know is not. It's not scary.
It's got, come on, no time to this. Let's go.
But yeah, I guess I should also say, in terms of introducing myself, that I run an account called the Tea on Birth Trauma. And this started 12 weeks postpartum. I knew immediately leaving the hospital that I wanted to do something to help other women who had been through this and other birthers. And so I just like literally on a whim on Canada Day decided to go with this. So, what essentially birth trauma is that it's subjective. And I just want to start off by saying that every is unique to every single person. So, if a birther is telling you, I suffer from birth trauma, it is going to be their own definition of that. So, there's no black and white clear cut. And like the DSM often offers like us a list of symptoms to go by that. But birth trauma doesn't really exist in the DSM, it's trauma. And birth trauma can be anything from an emergency C-section to a hemorrhage, like I described, to a stillbirth. Right now is Infant and Pregnancy Loss Awareness Month. So I'm very much thinking about those who have suffered stillbirths and a lack of support, obstetric and midwifery violence. So there's a lot of different causes that can take place. But what I'm discovering through my Instagram is that the biggest thing that people are speaking to is not being heard on that day and a lack of compassionate care. That seems to be the biggest thing. So, much like my story again, like you had the hemorrhage and almost losing your life, but what stands out to me is how I was treated. And there is no clear cut definition of it. It is really about your experience. If you leave that feeling like something wasn't right, I feel traumatized from this, I can't stop thinking about it. I'm having nightmares. I can't sleep over this. I feel a disconnect to baby. And I think that's one of the harder things there that people have some difficulties talking about is bonding issues with baby, and breastfeeding issues can come as a result, a direct result of birth trauma.
yeah, it's so important, I think, because we feel like we should ourselves all the time. Like we should feel bonded. We should be happy. We should be celebrating, but we're not because there's a heaviness and a darkness hanging over you from that experience. And we touched on this before we hit record, but I wanted to mention again that I think it's really important for any providers that are listening. We need to recognize that birth trauma as obstetrical and, midwifery care providers, that trauma is subjective, like you said. And so in my mind, lots of people that I support through birth have a completely what I would deem a normal birth. Maybe they ended up with an assisted vaginal delivery or a cesarean section, but everything went smoothly. There were no concerns for maternal or fetal well-being, but that could still result in trauma for the individual. So we need to understand as providers that it's not about our experience, it's about the experience of the birthing person. And we need more teaching and learning about this, definitely.
Mhm.
Yeah.
Mhm.
Yeah. So I'm glad we're having this conversation.
Yeah, me too. That's definitely one of my hopes for this and where I plan to take my doctorate is that I do want to get into the hospitals in midwifery care
Mhm.
and do more trauma informed compassionate care because that's a
Mhm.
very big buzzword and has been in our community for so long now, but people are using it and not practicing it.
Mhm.
So it would be nice to teach some of those basic skills for people and how compassion and empathy really go a long way for people.
Yeah. Oh,
Mhm.
absolutely. Absolutely. Okay. I couldn't agree with you more. I'm super excited to see where your journey takes you.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
So we've talked about birth trauma being the eye in the beholder. So somebody who is wondering if they've experienced birth trauma, do you have any suggestions on what people might think about or how they might reach out or ask for help or flush through their experience and see where they can go from here if they are feeling having some flashbacks or just feeling like unsettled, unsatisfied, disappointed in their birth experience?
Yeah, definitely. I think I'm going to start it off by saying that it's normal and that you don't need to search for validation around it. So sometimes we will seek that. We will seek a doctor to tell us, oh, yes, you do have birth trauma. If you are feeling like this experience kind of label or title suits your situation, then that's the first step is just know that your experience is valid and that you don't actually need somebody else to give you the green light to feel traumatized by something. And then I think the second piece would be reaching out to different supports that exist within your community. So Postpartum Support International, PSI, is huge. They're amazing. They are around the world. And I'm fully trained in them as well in terms of their perinatal psychology and care. And they offer so many different kinds of free resources because that often is an obstacle for people is therapy is expensive. I know this as a therapist, and that's why I always get in heck for my therapist friends for saying this, but I really say offer a sliding scale to your trauma clients because trauma work is long term as well. It's not short term work. And you want to reach out to places like Psychology Today, and you want to get into that Google search and put in perinatal psychology, put in birth trauma, because you do want somebody who specializes in that area. You don't want just a trauma therapist or a therapist, but somebody who has made it their mission to focus on that area and know the various different layers that you're encountering. That it's not just the trauma symptoms you're dealing with, but you're also dealing with being a new parent and maybe a first time mom and all of the layers that come with that as well. And then, yeah, Postpartum Support International offers all kinds of online therapy groups if you wanted to be a part of group therapy sessions. And then there's pages like my own where it is really a sense of community where every day I'm offering new topics to my followers, or every week, I should say, we pick something and we really delve into it. And I share everybody's responses anonymously and the power that comes from that, the sense of connection and community through that shared experience is incredible. So I really just want people to know that you're not alone. And that pages like mine at the T on birth trauma do exist. And then once you land in one of them, it's such a sense of relief to know that others exist.
Yeah. It's so true, like that, just normalizing the experiences. I speak very openly for it's really funny because I had what many would consider a very traumatic second delivery. I won't go into the details here. I've shared my whole all my birth stories on a podcast that we released, I think last year, but I ended up having like abnormal fetal heart rate and I needed forceps delivery and it was all fine. And the provider afterwards was like, "Oh, are you okay? That was quite traumatic." And I was like, "Oh, no, I'm fine." Because for me, like I, as a maternity care provider, I knew what was happening. I knew everything that was going on. I knew all I cared about was getting him out safely. I wasn't concerned about the forceps because I've done them myself. And I was like, "Oh no, I'm totally fine." Whereas for other people, that could be very traumatizing. So it's so fascinating how it's so individualized, but yeah, I had really severe postpartum depression, not depression, anxiety after my first, and I talk about that all the time because I just really want to normalize how challenging it can be to have a mental health diagnosis and how much shame can be associated with that. And the more we normalize it and we feel like we're a part of community and we're around other people that have experienced that, how healing that can be in and of itself.
Yeah. Oh, I couldn't agree more with that. I love hearing that. Makes me happy. And And just thinking about that has me reflecting on how much it's normalized that birth is difficult and painful.
Mhm.
And like that so much of that part is normalized in our society. And so that's why I think so many women stuff it is
Yeah.
I wanted this, I asked for this, I wanted to be a mother. I knew birth wasn't going to be easy. I need to just be quiet around this. And so many suffer in silence.
Ugh, oh, it makes me so sad to think that as somebody who is a mother and has birthed 3 crazy children and supported so many people through their birth, I just feel I love being able to do this work and I love being able to support people through it. I think many maternity providers want to support you through the whole process. So if you are struggling, a lot of us really want to know and want to hear from you. So I will make a point at my postpartum visits. And we're really fortunate here in Canada to have lots of access to care immediately postpartum. I know in the US it's very different, but it's really important for us to ask at those visits. And it's really important for us to hear from you. If there's things that you're struggling with, if there's and a really big tip I always remind people is to ask about what happened because oftentimes you have no idea. It happened so quickly, and there may have been there's always informed consent, but it is that's me snapping and it's going really quickly. And then I have patients be like, I don't even understand. I don't really remember why I had my C-section. And so I'll read the delivery note and I'll say, oh, here's what happened. The baby's heart rate went up, and then you developed a fever, and you weren't fully dilated. And then they're like, oh, okay. And then that gives you that sense of like understanding and being able to look back and process. And I don't know if you can comment around that and helping people. I don't want to say close the door because trauma isn't something we leave behind, but just have that understanding of why things happened the way they happened or why things didn't happen the way they might have.
Y- Well, and you're touching on two things right now that I think are really important. And one is that the follow-up that takes place. And that is something that's identified by so many women I speak to, or my clients, my followers, is like the lack of follow up that exists. We get that 6 week follow up and we're still in a haze and we're just coming out of that. And so I think the follow up definitely needs to extend past that 6 weeks. And then it needs to be a conversation that's asked every time and not just once in a blue moon or 6 weeks later. The other piece that you spoke to that I just want to touch on too is consent and informed consent because that is another factor that is spoken about quite often. And it really, I will say this as someone, the foundation of my work is consent and confidentiality. And so to hear how often it's breached and practitioners aren't gaining consent for women and just doing what needs to be done and questions later when there wasn't even an emergency that existed to warrant a consent not being discussed. So know that if you're listening to this and that you've experienced that yourself, that it's really valid. That if you do have questions afterwards and you're like, I don't understand why that happened or how it happened, and that you have every right to go through those case notes, like you said, and ask questions about how that came to be. But your question, sorry, those two, your question was what, Sarah?
Oh, I don't even remember, but I'm really glad that you followed up on that. I think another question I actually have is so one of the reasons that Alicia and I started this whole community in the account She Found Motherhood was because there is so much misinformation out there and there's so much pushing for natural birth. And I personally really don't like the term natural because I think all birth is natural. And I think it really puts a lot of shame on people who are not able to have a natural birth. To me, is a spontaneous vaginal delivery. Baby comes out with the power of mom in the pelvis. And that if you haven't had a natural birth, you feel really shamed. So what we wanted to do is put out some really reliable evidence-based information in an easy to digest way. And that also share what to expect and to understand that you may need an epidural because the baby is stuck and your pain is just unbearable and that's okay. And so understanding that birth happens in many ways and we can't really predict what your path will look like. And so just to understand all possible outcomes so that you go in feeling informed and empowered instead of going in with this narrow expectation that you're going to just have a spontaneous vaginal delivery, no complications. And then you come out and if that doesn't happen, then you feel really disappointed in yourself because you were set up to believe that natural birth is the best and if you can't have that, then there's something wrong with you, and I that makes me so upset. So I wonder if you can speak to that a little bit and how
Yeah.
what you can do in pregnancy to prepare yourself.
Yeah, I'm so happy you brought that up because I call it like the Hollywood version or the fairy tale version of birth. And we really set birthers up to fail in those moments, emotionally, mentally, sometimes even physically, because we aren't. doing enough preventative work around this. And like you said, that's my hope with this account is not to put fear into people. That's the last thing I want to do. I really do believe that knowledge is power and that the more that we know, the stronger we feel walking into a situation. I can think of my prenatal class and I never heard the words birth trauma. They touched on the various things that maybe could take place and they did it for a few seconds. And so let's spend a little bit more time there. Let's normalize the fact that these things do happen more often than not. Unfortunately, that hemorrhages are happening. I think the rates right now are 21% of births are C sections. That's huge. And a large part of that are emergency ones.
Mhm.
And so I think the more we talk about it, the less fear that women will actually have walking into those situations. And that's where I hope to get in. Like I said, is that I want to do a lot in hospitals. And I would love, this is my dream, Sarah. So remember I said this because here in Alberta, what I really want to happen is that I want trauma psychologists to be on staff. So
Mhm.
right after something like that happens, for them to be the ones. So I'm not even relying on doctors and nurses and that to do this work. I would like a psychologist in the room to sit down with that parent afterwards and say, "Are you okay?" Like, and if you're not, that's okay. And this is what, trauma symptoms look like. This is what birth trauma is. This is,
Mhm.
some of the long-term impacts that can happen. These are the resources that exist.
Mhm.
So that even if she wasn't given that preventative care beforehand, that she's getting it immediately after.
Mhm.
Because I think that too could make a world of a difference.
Oh, I agree. And I think the more collaborative and interdisciplinary, so meaning collaborative, meaning that doctors, psychologists, midwives, nurses, counselors all work together to support people and really focus in on our area of expertise, the better the care will be. Like, I am a physician, I am not a counselor. Lots of people access us for counseling because of the way our, medical system is funded. But I am not a good counselor, right? I can listen and I can offer medication advice and I can offer some basic skills, but we really need to bring in those people that are specifically trained in these areas to provide good support. And I think that's an awesome goal. I'll support you 100%. And then you can bring it to BC. How's that sound? Yeah.
Oh, well, that's the other dream.
Yeah, right?
Is the
Yeah.
my family to get a C. So who knows? Maybe.
Yeah. Yeah, I know. And I'm really glad you say that because Alicia and I, as physicians, that was like our reasoning behind why we created this program, this community. We have this online prenatal course and we talk about postpartum hemorrhage. We talk about neonatal resuscitation because lots of babies need a little bit of help breathing when they're born. And if you don't know that's normal, it's terrifying to see your baby not breathing. But lots of babies come out not breathing. And so we want to prepare people to say this could happen and it's pretty normal. And if this is happening, this is what your doctor's doing over there, that you might bleed, that you might have a shoulder dystocia, right? That these are things that can happen during birth and this is how we deal with them. And then we hope that the birthing people come in and no, nobody wants to have an emergency C-section or shoulder dystocia or forceps, but you have the education and the empowerment in place that if things are moving in that direction, you can make informed decisions because you're already prepared and you already have that information.
Yeah, definitely. Yeah, and that informed decision is important, especially again circling back to the consent piece. That's
Mhm.
all part of it. Is that
Mhm.
someone can't offer consent if they don't actually have all the information presented to them.
No.
Then informed consent didn't exist. It didn't have. Yeah, and I appreciate the page that you guys have and the information that you share because, like you said, there's so much misinformation out there. And that's why I wanted to do a page that is highly researched. And so every day I do something called the Daily Tea, where I pull out research articles and then give actual information that exists from studies that have been done versus like making up numbers, which you tend to see in the social media. Well, and it terrifies people, and that information can really hurt and impact people. And so that's also part of my page is that every so often I do what's called the T on. So like the T on old stuff was part of hemorrhage or C-sections or obstetric violence or whatever it may be. So that I'm highly researching these things before I give the information so that they can make their best decision moving
Yeah.
forward.
Oh, I think it's awesome. I don't even remember how we found each other on Instagram, but I'm so grateful that we did.
I do. I
Yeah.
remember. I did a fan Friday. And so often I asked, tell me your favorite like pages.
Mhm.
And so on this particular day, I think there was like 3 followers tagged you guys and we're like, they're my favorite. And so I tagged you guys back and said, hey, I'll shout out to you right after work. And then you're like, come be on my podcast. And I'm
Yes.
like,
Totally. I want to learn more about birth trauma. I want people to understand more about birth trauma. I want providers to understand more about birth trauma. So I'm so grateful that we found each other and that we were able to do this podcast.
thank you. Thanks for having me.
Oh my gosh, you're so welcome. So if people want to find you. You've got your Instagram. Can you share that handle again?
Yeah, it's at the T, so like tea that you drink, TEA on birth trauma.
Okay.
At the T on birth trauma.
Perfect. And we'll link that in our show notes. And then if people are wanting to get in touch with you more directly or access your services, is there any way we can send them your way?
Definitely. So I'm currently on maternity leave and I'm seeing just a small amount of clients. So I'm full at this time, but I'd be happy to answer questions that people have or direct them to a birth trauma therapist. Pine Integrated Health, I want to shout them out. I'll be working with them next year. So I'll be off my mat leave in January, a little bit earlier than Livy's 1 year. But that's where I'll be headed to is doing perinatal psychology with Pine Integrated Health. And they specialize in that area. And so if you need support and assistance and you're in the Edmonton and surrounding areas, I would definitely say get in touch with Pine Integrated Health.
Awesome. Amazing. Thank you so much, Teela. It's been an absolute pleasure talking to you.
Thank you, Sarah. I agree.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.